trainer David. Today's topic is going to be Medicare 101, Part A.
And then to be followed up with Part B.
Now, this is really the meat and potatoes of Medicare. And if you can really get a good handle on this and explain it to your customers, the rest of the selling plans just is nothing. It's like, where do I sign up?
Right. So Medicare Part A and B is also known as Original Medicare. So please don't be confused. If you hear us say Original Medicare, it's referring to Part A and B combined. So Medicare Part A is also known as the hospital insurance. Medicare Part A helps pay for the inpatient hospital care, inpatient care in a skilled nursing facility, and home health care, hospice care, but please note inpatient. Medicare Part A covers inpatient hospital care when all of these are true. You're admitted to the hospital as an inpatient after an official doctor's orders, which says that you need inpatient hospital care to treat your illness or your injury. The hospital must accept Medicare.
I had a friend who, went to the emergency room and they said, we're going to hold you overnight for observation.
Oh, that's not good, because it has to be admitted in order to have Medicare Part A cover that expense, right, David?
That's the key thing there. And we just really can't stress admitted enough because observation is not being admitted to the hospital, even if you stayed for a couple of days.
Right. So now keep in mind that the Medicare inpatient hospital care coverage will include the semi-private rooms, meals, general nursing, the drugs as part of your inpatient treatment, or the hospital services and supplies. But hey, David, if I had been admitted as a Medicare recipient and I wanted a chocolate shake and it wasn't part of the meal plan for the doctor, is Medicare going to pay for that extra for me?
No, I think you're going to have to get your family or your own pocketbook to pay for that.
How about a newspaper?
Nope.
Okay. So inpatient hospital care includes care that you get in the acute care hospital, the critical access hospitals, inpatient rehabilitation facilities, the long-term care hospitals, inpatient care as part of a qualifying clinical research study. Please note, qualifying. And then, of course, the mental health care. So you are going to pay for that private duty nursing, the television, the phone in your room. You pay for that private room unless it's been deemed medically necessary.
Like if you had some kind of a communicable disease,
Highly contagious?
Really contagious, then you could have that private room.
But again, the doctor has to make it
medically necessary. Now, to receive some of the other assistance under Part A, like the skilled nursing facility, again, the physician has to certify that you require that daily skilled care that can only be provided for an inpatient in a skilled nursing facility. Now, here's the real zinger though. The beneficiary must have been inpatient, that word again, in a hospital for at least 3 consecutive days for the same illness or condition before being admitted to the skilled nursing facility. So not only do you have to be admitted, you had to have been in there for 3 days. So that day or two you spent in observation didn't count.
Because it has to be 3 consecutive, 72 hours consecutive.
And we would tell you that if you saw that you were at 70 and they were talking about discharging you, go hide.
Go to the cafeteria, go to the restroom, go hide, because that discharge nurse can't give you your paperwork until she finds you and you sign off on it.
Okay, so you got to get that 3 days. Then, if you went home, instead of going directly to the skilled nursing facility, you've got 30 days in which to go to the skilled nursing facility and still be covered under Part A. Okay? And of course, the facility has to be Medicare approved. So let's look at the cost in the skilled nursing facility. Part A is going to cover that first 20 days at $0 copay. Once you hit day 21, that cost goes to $170.50 a day as your copay for days 21 through 100 per benefit period. We'll kind of spend a little bit more time talking about how the benefit periods work. But your cost per day is $170.50 for the days 21 through 100. And then after day 100, the individual, the Medicare beneficiary, is responsible for all costs in the skilled nursing facility. So you only got 100 days of skilled nursing facility. And again, includes all the services and supplies that are medically necessary after a 3-day minimum inpatient hospital stay for the related illness. The inpatient stay begins the day you're formally admitted and includes any skilled care, IVs, injections, physical therapy, everything that's covered while you're in the skilled nursing facility. So if you don't meet that 3-day requirement, now what? Home health care. You can actually get a lot of this simply done at home, at which case Part A will cover at $0 copay. The difference being is now you're at home, you're not in the skilled nursing facility, but you can still get that intermittent nursing care, physical therapy, speech therapy, just about any kind of occupational therapy that would be necessary, and that will all be provided at home. Few requirements to receive that home health care services under Medicare. You got to meet the following rules. The physician has to certify that that it's medically necessary, and an approved treatment plan for one or more services, like the physical therapy, maybe speech or language pathology, or occupational therapy. So the key thing here is that you have to have a beginning and an end, and you must show improvement towards an end result, because they will terminate your at-home care if improvement ceases. And this last little part that is covered under Part A is hospice care. Now, hospice care is for the terminally ill, and it's going to be covered under kind of that comprehensive services of Part A. It can be at home, it can be in a facility, but they're only going to do symptom management and pain control. So the healthcare provider must be certified by Medicare to provide the hospice care. The doctor and the hospice care director must certify that the patient is terminally ill, and that's their definition of terminally ill is going to be life expectancy of 6 months or less. Now, one of the reasons many people don't want this is, again, any attempts to cure what you have, treatment like chemotherapy for cancer, radiation treatment, all of that stops. You're not going to receive any more treatment. One of the other things under Part A, from one of the earlier slides, if you remember, was any kind of drug plans and clinical trials. You're not eligible for any of those if you're on hospice. So many people will not elect hospice because of that. Now, the patient has to elect hospice coverage for the terminal illness instead of the standard Medicare benefits, although Medicare will continue to cover for everything else that except for the terminal illness. The terminal illness will be symptom management and pain control. So again, let's talk a little bit about enrolling in Medicare itself. It all starts when you turn 65. And if you are already receiving, we're going to put you in a couple of different categories here. So you're turning 65 and you're already receiving Social Security. Remember, that could have started back at age 62. Or you could have been a railroad worker, in which case you fall under the Railroad Retirement Board. For the sake of this webinar, anytime you hear Social Security, it's going to include Railroad Retirement Board because they perform the same function. It's just the two different groups will call the correct service. Okay. So you're turning 65, you're already drawing Social Security, your enrollment into Medicare for both Parts A and Part B will be automatic. About 3 months prior to your birth date, you'll receive your Medicare card in the mail. You'll have options in there, but your enrollment will be automatic. Now, there are people out there that are age 65 and they're receiving Social Security disability income. Again, if you were under 65 when you started receiving your SSDI, your enrollment will be automatic into Medicare Parts A and B, occurring at about the 23rd or 24th month of disability. So ideally, you'll receive your enrollment period package about 3 months prior to that 25th month of disability benefits. All right. The next kind of group will be those who are turning 65, but they were not drawing any Social Security. Probably they're still working, or maybe they didn't need the income and wanted to hold out till full benefits at 66 or even age 70. So for those people, though, remember, if you're not working, Medicare is the only source of medical insurance at that point. So they've got some options here, and I'll give it to you kind of in the easiest to the hardest. You need to contact Social Security about 3 months prior to the birth date. You can do it one of 3 ways. You can go online, and for those who are very computer savvy, it's very simple, take you about 10 minutes. ssa.gov, Social Security Administration.gov as in government. It'll have you fill out who you are. It'll do a few checks to make sure that you are who you say you are, and then they'll sign you up. The second method would be to call Social Security. If you're going to call Social Security, it's 1-800-772-1213. After about a 45-minute wait, they'll come on the phone, and it'll take about 10 minutes for them to sign you up over the telephone. Now, some groups of people will not be able to either call them or do it online, and we're going to need to go down to the office. The reason I say that is last is because plan on spending a morning or an afternoon. It's going to eat up your day to go down there. But the ones that are going to want to go there, the biggest group will be one with no computer or telephone. Number 2, those who are going to need additional paperwork. Naturalized citizens, for one, typically going to have to show all their paperwork or that they're now a citizen and are eligible. One of the other groups that I ran into, almost a funny story, would be born out in the country with a midwife, so they know their birth date is one day, but it got registered as a different date, sometimes months later. And so a lot of those folks have a lot of problems producing documentation, and they're going to need to do that at the Social Security office. Now, if it turns out that your customer is a Railroad Retirement Board, it's a different phone number, but it's going to be 1-877-772-5772 for the Railroad Retirement Board. But the conditions are all the same. So Part A. So Loren, does Part A have a premium? You have to pay for that?
Yeah, you got to pay for it in certain circumstances. Because with Medicare, there's always an exception to the rule.
And most people get Part A coverage without having to pay a Part A premium. And that's just because they or their spouse, can be a husband and wife, paid Medicare taxes while working. And they had to do a specified duration of time. You had to develop 40 credits. That works out to be about 10 years of working. Now, that did not have to be done all at one time. It did not have to be as a W-2. You could be self-employed, but you needed to have that 40 credits. For those who did not have the 40 credits, and I'll give you a few examples here in a moment, you're going to have to pay $437 a month for Part A. And I always try to remind people, remember, once you turn 65, there is not another insurance you can go to. I mean, it is Medicare or nothing. So $437 a month for just Part A. If you did pay, into it, maybe you worked for a while, but it was not the full 40 quarters, but you did work at least 30, you can get the price down to $240 a month. But for most of us, it's going to be that zero premium because we've met the 40 quarters. I've had a few customers from time to time that we had to delay entry just to meet that a couple more quarters of work so that it would be a zero premium plan for them. A deductible. Part A has a deductible of, and it's going to be by benefit period, and I will break that down for you. It is $1,364 for the benefit period. Remember now, Part A is only hospital. So if you're admitted to the hospital, that first 60 days that you're in the hospital as part of that benefit period is covered by the deductible. After 60 days, Medicare has a co-payment of $341 per day for the rest of the time that you're in the hospital during that benefit period. That means that you had no time out of the hospital. That was continuous, 90 days in the hospital. Now, if your stay goes beyond 90 days, Medicare will still cover up to an additional 60 lifetime reserve days at where your copay is $682 per day. And then anything that goes beyond those 150 days total, you would be paying the full cost. So the way that benefit period works is that once you've been admitted to the hospital, until there is 30 consecutive days out of the hospital is your benefit period. So kind of worst case, you could be 4 benefit periods in a year. You could pay that deductible 4 times.
It's a lot of money.
It's a lot of money. If you're a mental health patient and you're in a psychiatric hospital, Medicare only covers 190 lifetime days. So it's not broken up by the benefit period anymore. If it's the mental psychiatric hospital, you get 190 lifetime days in the psychiatric hospital covered by Medicare. Now, on that lifetime limit of 60 days, remember in your benefit period, you got 90 days in the hospital. If you go beyond that, you do have 60 additional days, but you can, if you use 30 of them, then you've got 30 left. But once those 60 are gone, Medicare would only be covering 90 days of hospital time.
So that's only a one time up to 60 days.
Up to 60 days, and
now,
they count each day.
Okay, and who keeps track of that?
CMS keeps track of that.
Oh, so right when you thought you could get away with a little shenanigans, not so much.
Not so much. Okay, so that was kind of your Part A, but Part A was hospital. And now we're going to look a little bit over at Part B.
So Medicare Part B, which is also known as the medical insurance. So, ooh, I'm seeing a trend here. We've got hospital, now I've got medical. Okay, getting it. It's moving right along here. So the Medicare Part B is going to help pay for the doctor's visits, the outpatient services, durable medical equipment, x-rays, lab tests, ambulance services. So again, this is kind of going into that, what they're covering, but you'll also notice that it says diabetic testing supplies, preventative services is the wellness checks as well. So outpatient medical and surgical services and supplies. Kind of neat if you ask me. That clinical lab test, good, covered. So Part B covers two types of services. So we have the medically necessary. So services or supplies that are needed to diagnose or treat your medical conditions and that may accept standards of the medical practice. So David, who deems a person medically necessary?
Well, it's going to normally be your primary care physician, okay? Not your dentist, not your chiropractor, not your next door neighbor.
Oh, really? Okay, well that doesn't help me much. So preventative services. So preventative services are health care to prevent illnesses like the flu or detect an early medical problem, obviously in the early stages when treatment is most likely to work. Please note that even though it's preventative, we're going to go into more detail on some of those services that are going to be covered as preventative, but could turn into diagnostic.
Some of them require just a bit more explanation.
Right. So again, covered services, doctor's visits, clinical research, ambulance services. We have the durable medical equipment, mental health, inpatient, outpatient, partial hospitalization, or getting a second opinion before a surgery. It's limited to the outpatient prescription drugs. Now, please note, some of you are asking yourselves, why would we need ambulance services? Well, say you have that client who unfortunately slipped, fell, broke their hip, was admitted into the hospital, had 3-day stay in the hospital after that emergency hip replacement, then was sent on to a nursing home. Well, how do you think your client's going to get to said nursing home? An ambulance.
Yep. Medical transportation.
Medical transportation. And then again, whenever they are leaving said care facility, when they are ready to go home, again, ambulance services. So please note these preventative screening services that are covered, but David and I are going to get into extreme detail on this. So you'll notice that there's all kinds of counseling, various cancer screenings, blood tests.
Some things are one time, some things are annual, some are on a schedule. I think the key thing on here is these are all provided by Medicare at zero copay.
Because again, it's preventative. But let's say you have that situation where a person has to go in for their colonoscopy.
That's a common one that comes up.
So the person goes in for their colonoscopy as they are at certain ages in life, it is recommended, and the doctor finds polyps. Doctor removes said polyps and then says, well, hey, we need you back next year just to check up, make sure everything's going great. This is no longer considered preventative when you do your follow-up next year. And why is that, David?
Now it's diagnostic. It's not a preventative check, it's diagnostic. And it just went from a zero copay to 20% coinsurance. And one of those particular things can be about $3,000, and you're paying 20%, so you went from zero to $600 copay.
Big difference.
Don't let your customer fall into at least being shocked about it.
Now, please note, just because the customer is new to you, you don't know what any of these screenings that they have done in the past. So even if they're trying to tell you, oh, it's preventative, but that person has had colonoscopies in the past, and the same scenario that David and I are talking about. Do not get into in-depth discussions about diagnostics versus preventative, because ultimately it is the doctor who has written the information in the medical file, and that follows along with the individual. So cost, is there a cost to that Part B?
Yeah, and just like everything else in Medicare, everybody doesn't pay the same.
Wait, they don't?
They don't. Most people in Part B, you're going to find it's going to be that $135.50. But it's income based, and it can vary from the low end of $135.50 to the high end of $460.70.
So what's a perfect example of someone that has to pay that $460.70? That's per month?
Per month.
Ouch.
We'll get to that in a moment. There's a table that would show exactly what your earnings have to be to wind up there. But the other thing I would like to point out is that you can see that between that Part A premium, if you had to pay it, and the Part B premium, you're looking at close to a value of about $1,000 a month for Medicare. I think it works out to be about $979 if you were paying the Max Part B and the and Part A. Okay. So there is a deductible. Part B has a deductible of $185. It does change from time to time. Goes up just a few dollars with cost of living each year, it seems like. And then once you've met that deductible, Part B will pay 80% of the approved charges for the remainder of the year. Here's the thing though. There is no maximum out-of-pocket limit on that 20%. So most of the doctors in Medicare, when you come in and you go to see the doctor, they're going to want your copayment at time of service. So we'll just say, for sake of argument, you found a doctor that would see you for $100.
I don't think I want to see that doctor if he's only $100.
Well, me either, but we're just using this for the easy numbers.
Okay, thanks. I appreciate that. So
for a $100 doctor visit, Medicare would pay 80% or $80, and you would pay 20% or $20, normally collected at time of service. Now let's just extend that to you need a surgery, and that surgery is $100,000.
Ouch, that's $20,000.
Okay, now let's don't even go into transplants that can run into the millions.
Oh yeah,
And so you can see that that's the biggest drawback with Medicare, and why most people would be looking at either a Medicare supplement or a Medicare Advantage plan, because this is the place that if you do get sick, you can go bankrupt.
Many times over.
Yeah. So here's kind of that table I promised you. If you've, for most people, when they're retired, as an individual or husband and wife, their tax filing is probably under $170,000 a year, and that's the $135.50 premium. But you can see as you make more money on the table, your monthly remated adjustment amount goes up. So at the far end, if you're making greater as an individual greater than $500,000, you'll be paying quite a bit more for your Part B premium. I would hope to think that you don't care, but
yeah, that kind of money, I'm not really gonna worry about that premium.
All right. Customer that didn't sign up for Part B when they were first eligible. Well, Medicare again has that late enrollment penalty. Now, if you were working and you just at age 65 and you were still, in a plan at work, okay, you're not required to quit that plan at work and go on to Medicare. Okay? You can stay in that. And what will happen then is you would get a special enrollment for loss of Medicare, or for loss of medical insurance, just like in the under 65. It would give you that qualifying event, or only in Medicare we call it a special enrollment period. So for those who didn't get Part B when they should have and had no other insurance, for every 12-month period that you were eligible and did not sign up, your price went up by 10%. So you could see after 10 years, you're paying double.
Very expensive.
Okay. So if you did have that where you delayed your Part B entry, that's a special enrollment, and there's no penalty involved with that. Now, the ways you can make your payment, if you're on Social Security, they will automatically deduct your Part B premium from your Social Security check. And the same works if you're a retired railroad worker. So the Railroad Retirement Board would withhold it from your pension check. Some federal employees can have it withheld from their federal pension check. But for most people, if you're on Social Security, this gets withheld from Social Security. If you're not on Social Security, quarterly payments. You'll get a bill in the mail from CMS that will be asking for a quarterly payment. Instead of the $135.50, it'll be 3 times that. Unless you do have an opportunity to fill out the Medicare Easy Pay form, and they will deduct it from your bank account. But they will only do that if you're not on Social Security or using one of the other payment methods.
Coverage and cost sharing amounts. The deductible is met. Doctor services, outpatient services, home health visits, home medical and health services, prescription drugs, outpatient treatments of mental illness, wellness, and preventative.
No, I thought prescription drugs were Part D.
Well, there's always an exception to the rule. So if your doctor pulls out his little tablet and writes you a piece of paper on that prescription, and you have to take it to the pharmacy, that is Part D. However, say you have an individual that has to go to the doctor's office for that cortisone shot, or another one that we've been hearing a lot lately, is the allergy shots. Mm-hmm. So if you have to go into the doctor's office for treatment, the doctor's office will bill it to the Medicare Part B.
Okay, so just remember that shifts that cost to 20%. Right?
Correct.
Yeah. Exclusions. I always really hate dwelling on exclusions under Part B. We'll hit them real quick here because the thing about that is if you look at some of the Advantage plans, many of these exclusions will get picked up. But we'll talk about it. If you're straight original Medicare, just that A and B business, don't cover dental, won't do eye exams, as far as glasses. Now, diseases of the eye are still covered, like cataracts and glaucoma, but we're talking specifically prescribing glasses. Glasses are what's not covered. And along with dental, dentures, implants, they're not covered. Anything labeled cosmetic on the surgery side, acupuncture, hearing aids and exams for fitting them, long-term care, concierge care. Really, if the doctor bills Medicare for the services, that's would be covered, but the retainer is not covered. That's all on the customer side.
Now, David, I did have a question because it has come up. So those dental implants, because It doesn't say anything here, is it going to be a covered benefit?
No, because it's still considered, falls under that most dental.
Oh, okay. What about, because you have prescription glasses, what if it's a prescription sunglasses or even those contact lenses?
As far as the glasses and the prescriptions for glasses, that's specifically not covered. It's strictly going to be the diseases of the eye. Medicare, I would always tell you in Medicare to file a claim, for just about regardless of what it is. I always hate that question. Is XYZ covered by Medicare? And the answer typically is, one, is it medically necessary? And if so, probably. That doesn't mean that there won't be a copayment, that you don't have to meet a deductible or any of those things. But I would always encourage people, I mean, there are oddities in there. For example, hearing aids and exams to cover them are not covered. Cochlear implants are.
Yes.
So
Again, as David and I have said in prior webinars, as well as this one, there's always an exception to the rule with Medicare.
now, you didn't enroll in your Medicare Part B during your initial enrollment period, you still have another chance. Each year, there's a general enrollment period. So from January 1st to March 31st of each year, for those who didn't enroll when they were supposed to, back when they were turning 65, and without an SEP, I always have to stress that, and you don't have an SEP, the general enrollment is every year from January 1 to March 31. Now, even though you enroll in the first quarter of the year, your plan will not, and your coverage will not begin until July 1 of the year, of that year. So enroll in January through March, start in July. And that doesn't mean that you're going to be exempt from the late enrollment penalty either. You may have to pay that late enrollment penalty for as long as you have your Part B coverage, and your monthly premium would go up 10% for each 12-month period you were eligible for Part B and had not signed up for it. A few other cautions when discussing A and B. Never talk in absolutes, and by all means, never overpromise. I would learn to have Medicare speak, to answer questions, use answers along the lines of, based on what you have told me, this would be the best plan for you. You know, so that I definitely have not oversold it, I've not overpromised it. I didn't say it was absolutely the best plan. I said, based on what you told me, it's the best plan. So if you left out something, not my fault, right?
Again, guys, we're trying to keep it simple. Do not promise your clientele the moon, the stars, and everything in between, because chances are it's not out there. You could come close, but that doesn't mean it's always out there.
That's why we wanted to make sure that you have a good understanding of how Part A and how it works, Part B and how Part B works, because you can see with all those limitations in there, everybody does need something to help fill in the gaps.
So guys, thanks for attending and hanging out with David and I. We really enjoyed having you here and appreciate you spending some of your very valuable day with us. But if you have any questions, don't forget to email the training box, and David and I will be more than happy to answer those questions for you.
Okay, if you do have any questions, be sure to do that. Other than that, you can probably pick us up on one of our webinars just about every Thursday. We call that Same Bad Station, Same Bad Time.